Welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos, and if you're new to us, welcome. We're so glad to have you. In this particular show, we're absolutely crazy passionate about healthcare innovation and adoption, and our aim is just bringing stories of real people that are within the space, that are truly innovating within healthcare. We've got just an amazing lineup of interviews, stories, people who are really truly innovating within the space, and we just got a really action-packed year. So if you haven't been with us, we're so glad to have you. And in this particular episode, we're kind of running on the theme of innovating within sort of the surgical space, and I'm just delighted to have Dr. Monica Jain, who is the Chief Surgical Innovation Officer of Cedars-Sinai. Dr. Jain, great to have you on the show.
I'm so happy to be here and be talking to you, Michael. This is great.
Awesome. Well, let's just kind of dive right into it. Your background is very interesting, being a clinician, being someone who sees patients day in and day out, and you're also the Surgical Innovation Officer at a world-renowned institution. Share a little bit about sort of your story into how you have gotten into this role.
Sure. So I actually come from a background of engineers. My entire family, they're all engineers. And so I thought I wanted to be an engineer from the very beginning. I went to Boston University for biomedical engineering. And from there, working in research, I just fell in love with medicine and taking care of patients, and made the transition to go to medical school, and there actually fell in love with surgery. So many years later, after much training, I am now a general and endocrine surgeon, but I never lost that engineer deep inside me. So now I work a lot in surgical innovation and healthcare innovation in general to try to bridge the gap between engineers and clinicians, and really bring those two sides of me and also two sides of healthcare innovation together.
That's awesome. So there's an aspect of innovation that really requires building bridges, and it sounds like you've done a lot of bridge building, on your way here. Can you maybe share a little bit about how you guys have been innovating at Cedars-Sinai? We've had a really interesting season, and I'm just curious if there are any notable stories that you may want to kind of line up with, and we can dig deeper, from there.
Sure. We've done a lot of different a lot of work in a lot of different areas. So we have an accelerator here at Cedars-Sinai that's been going on since 2015. And we've had many healthcare startup companies come through and really make way in developing themselves and getting implemented into big healthcare institutions, not only our own, but across the country and even across the world, and really advancing the way that we practice medicine. We also have been collaborating with engineers at Caltech. That's something new over the past year, which has been very exciting, and bringing the technology that those very smart engineers at Caltech have developed and bringing that to clinicians and asking what needs do those clinicians have, and how can we solve them? And bringing those two sides together has really brought around a lot of new projects, developing new technologies and having spin-offs related to that. And we do a lot of work with startup companies outside of the accelerator as well, bringing them into our institution, doing clinical trials, doing human factors trials, and really helping to push these companies forward and show them how they can be adopted, what they need to really be effective in medicine. And so we really are very passionate about innovation here at Cedars-Sinai.
Yeah, it sounds like from a culture of innovation, it's really driven through this culture. Is that driven through leadership? How does leadership view innovation? Just the reason why I say that is to be able to actually implement and execute requires a level of access. And it just seems like Cedars-Sinai is providing a greater level of access more than normally that you see across healthcare. And where does that come from?
So Cedars has been an innovative institution, I think, since its birth. We had doctors Swan and Gans here who developed the Swan-Gans catheter, which probably a lot of the people listening know that was a revolutionary catheter in the field of cardiology and cardiac surgery. And so since the beginning, Cedars has been very innovation has been ingrained within Cedars, and the leadership has always been working to promote that. And in the modern culture of healthcare innovation, they've really been working with a venture fund, with an accelerator from the top down to advance the culture of innovation at Cedars. So yes, definitely it's very much leadership driven and leadership supported at Cedars. And I think that that's very important in driving the culture of innovation anywhere.
Well, we'll dig into that leadership part in a little bit with you know, some of the programs that you guys are running as it pertains to leadership within the organization. I'm just curious when it comes to honing in on problems. What is the methodology that you and the team, how do you view problems? How do you prioritize them? Can you walk us through what that process is?
Sure. So some of the problems are just brought forward by our faculty and staff. And so there may be a error that occurs, there may be something that happens that kind of brings forth a problem within the system that then needs to be solved, and we find a solution that can target that. A lot of it actually comes from talking to everyone who works at the institution. So we have a lot of engagement from our faculty, our nurses, our staff, technicians, whoever it may be, and we are continuously talking to them about what problems do they encounter and what can we potentially do to help them in that. And based on either solutions that we have already identified and potentially deployed elsewhere, we can deploy them in other areas or find other solutions that can help these people. And obviously for us, the priority comes for our patients. And so what's most optimal for patient safety, efficacy, and quality of their care, that's how we prioritize what's most important for us at this institution.
Okay, so patient efficacy, quality, and care. So when it comes to discerning whether or not if something can be solved in-house or going outside, walk me through what that process is like, because you know Cedars is very has robust resources, you know, in many respects, people, processes. What does that look like when it comes to making the decision when it's saying, hey, we don't think that this is within our lens internally, then we need to go externally? Can you provide an example of when, you know, something wasn't solved internally and you had to go externally?
I think we have a few examples of that, and most of them come actually from the startup companies that come through our accelerator. And some of them actually identified problems and brought problems to us that we didn't even realize that we had. And so they were actually the ones who saw these problems elsewhere and brought the innovation to us and made us realize that we have these problems as well and that we should be solving them and helping out our faculty or staff or patients with these issues. And so one potential example would be an innovation related to billing and management of physician billing. And, you know, we thought that we had very optimal processes related to that. And we found companies that did it better and made it more efficient and, you know, helped us out with that. And so we actually decided to use them and implement them to help us with all of our processes. A better example probably is our patient communications. We have a lot of staff who are involved with communicating with our patients, and we try to engage our patients continuously, make sure that we have appropriate follow-up, and that usually requires a lot of manpower. And we wanted to be able to improve that. And we had a company come, actually multiple companies who were able to provide us with various solutions, either on the patient information side, on the patient messaging side, patient appointments, and we were able to significantly improve our waiting times for our clinics, the ability for patients to get into our clinics and get scheduled quickly, the ability for our patients to schedule other tests and procedures, for them to interact with our clinics. And so that has actually been a huge innovation for us in communicating with our patients, allowing our staff to be freed up to focus on other issues that are not just administrative and actually taking care of patients more. And that has been very, very big for us in how we manage patients and deliver care to our patients.
That's awesome. On the flip side of that, have there I'm assuming there probably have been, but any innovations that have been tried to be deployed across, whether it be a department or a segment that really haven't gone well, and what were some of the learnings from that?
We've had some issues with employing some digital health solutions within various departments. Part of the issue with that is that there's some overlap between various solutions. And so we have some solutions that can do something and another company that can do something else, and trying to bring the two together can be very difficult. And also integrating with the EHR is always a difficult situation. And so, we have a very robust information services department that takes care of a lot of these things, but sometimes the solutions are just unable to be implemented in a way that really facilitates the way that clinicians interact with the medical record and interact with patients. And those have definitely been solutions that we have not been able to integrate, and unfortunately had to forego.
So talk about, innovating in times of, unprecedented times now, folks not being able to come on site to deploy solutions. Can you talk a little bit about how some of this remote deployment of technologies or even processes and how that's worked?
So I think that we have actually had a huge spur in innovation in the past year. However difficult COVID has been, and however much grief has come from it, it actually has really spurred healthcare and innovation in healthcare significantly. And so many of the problems that we have been seeing in healthcare, we were not really getting solutions to until we were bogged down by COVID. And then all of a sudden, we started seeing so many solutions and really rapid evaluation, implementation, adoption. Obviously, one major example is virtual medicine or telehealth, and really implementing that for our patients so that we could see them virtually, not make them come into the hospital, try to keep them as safe as possible. And this is something that I think clinicians have wanted for a long time, patients have wanted for a long time. We don't necessarily need to see our patients in person all the time. We can do a lot of our evaluations virtually, follow up with patients virtually, but we still want that face-to-face interaction. And so employing this telehealth platform for our entire institution was a big ask, but COVID forced us to do it. And now we have that. And even outside of a major COVID surge, we're able to still provide that service to our patients. And they're very grateful for it, especially not having to drive in LA traffic to get to our institution. So definitely, although COVID has been difficult, it really has spurred healthcare innovation. And the remote capabilities are also really great. So we've been connecting with people across the country who we otherwise might not have connected with. Like you and I connected, and I don't know that we would have connected had it not been for COVID and this virtual environment that we live in now. So, I think it's really fantastic, and it's been good for healthcare innovation for sure.
Yeah, absolutely. So, I mean, just when I think about surgical innovation, I think of sort of three distinct phases. You have the before phase, then the sort of the in the actual surgery phase, and then you have after postoperative care. Maybe we can shine the light on, in surgery, what kind of innovations have happened, inside of the operating room, from a patient safety, de-risking perspective, anything that you can shed some light on?
There have been a lot of advancements in surgery related to the instruments that we use to do our operations, mostly related to laparoscopic and robotic surgery. And robotic surgery especially has been much more widely implemented over the past few years. And we're learning more and more as to the situations that we can apply it in and what different challenges those various situations have. And then managing the technology or improving the technology to manage those situations. So that's been something that's very exciting. We have a bunch of new instruments for robotic surgery, some more automated instruments for laparoscopic surgery, especially some new staplers and clips and things like that. Some new energy devices, which are very good. Things like that have been really fantastic and have really pushed surgery forward rather than a lot of the poor visualization, hand tying, or hand doing everything. This has really been a big advancement for this field.
Nice. And when it comes to I've spoken to several surgeons, and there's sort of two sides of two camps.
Mm.
Ones that understand that virtual health is very important, from a at a distance exam. Does there come a point where you feel like there might be some concerns about not being able to physically examine a patient? Maybe there's something that you might not necessarily catch because as a clinician, you're seeing, you're touching, you're feeling. Have you seen any any downstream effects of not being able to see people in person? Um, maybe talk a little bit about that.
Sure. There are certain clinical situations in which we definitely have to examine patients. I would say hernias are a great example of that. Every hernia is different, and every patient has a different situation. And being able to physically examine them and see what the hernia looks like, where it's located, and kind of considering how to repair that hernia is different in every patient. And that's something that that type of physical exam cannot be replaced and should not be substituted really by virtual health. I think that's one thing that I would say, one area definitely that I've experienced that we shouldn't be doing that. In many other situations, just a eyeball of the patient, meaning that watching how they walk into your office, seeing if they look like they're generally in good health, have energy, or if they're having a lot of difficulty walking in, or they have multiple other problems, those types of things actually make a huge difference in seeing how risky a potential surgery may be. And so,
Mm.
yes, there is definitely a lot of benefit to just seeing even a patient walk into your office and see what they look like when they walk in, they sit down, they move for your physical exam. Those small touch points actually make a big difference in decision making, even if it's subconscious for a lot of people. So, I definitely think that there is no complete replacement for seeing patients in person and doing physical exams, but the added benefit of virtual health for or telehealth for monitoring patients, following up with them, not making them come in just to discuss test results, or after a simple operation where they're healing well, that has minimal risk of complications, that they don't have to come in all the way to be evaluated. Or even for patients, for example, who are visiting from somewhere else who come to our institution to have surgery, they don't have to stick around for weeks afterwards to make sure that they're doing okay. They can go back to where they came from, and we can follow up with them virtually, in combination with their doctor at the place that they actually live. So those types of things are all definitely feasible and very important in the virtual world.
So you talked about earlier about companies that are innovating, that are solving problems that Cedars-Sinai is not aware of. Um, just kind of maybe looking down the line, are there problems that, like, what are some of the problems that you think are being overlooked, now, and which ones do you think have the biggest risks, from whether it be from a patient impact, a financial impact? Are there any ones that you think are being overlooked? Because you can't obviously solve all the problems all at once, but I'm just wondering, are there problems that you think that haven't been looked into, and which ones do you think sort of ring a bell for you?
I would say that's pretty difficult. There's obviously a lot of problems out there, and nowhere in medicine is everything perfect. But most of the problems that are major issues, and especially related to patient safety, those types of things are being worked on continuously. And for example, surgical site infections, or kind of managing the way that we treat our critically ill patients. Those are all kind of problems that we've been focusing on continuously, and making sure that we're taking good care of our patients and making sure that the care is safely delivered. So, it's very difficult to kind of pinpoint specific problems that are very big that are not being handled. I would say that in general, continuously improving the patient experience is one big thing that we can manage, and something that we should work on. Obviously, for example, patients hate being pricked to get blood draws, or IVs are very difficult to put in. And that is an ages old problem that many, many people have worked on and continue to work on. And unfortunately, we have not had any good solutions yet. And we're still waiting for someone to have a great solution to that. So those are problems that are not necessarily being overlooked. It's just patients that, or problems that we don't have good solutions to, even though we've been trying and trying and trying. So things like that, and kind of improving our treatment of patients and treatments of rare diseases, and even treatments of common diseases. There are always improvements that can be made in terms of treating, preventing, monitoring, and those are things that are being worked on continuously across the world, but not necessarily an immediate focus at any single institution or at Cedars specifically.
So when it comes to measuring success, I think, we all love to hear about innovations and outcomes and success stories, but, how does the system, how do they clearly define what success looks like? And is it sometimes even measurable, or is it something that's a little bit more, subjective?
That's a great question. I think for us, success is how our patients are doing. How are our outcomes? Are our patients doing well after they come here to get treated, to get surgery, to get care when they have an emergency issue? How are they doing? How are we comparing to the rest of the country and the rest of the world? That's the biggest measure of success for us. And right along step with that is, are patients happy when they come here? Are they happy with their care? Do they feel like they've had all their questions answered? Are they well taken care of? So those are things that we use to measure success. And in general, Cedars actually sits very well on the general spectrum across the country of how our outcomes are, especially in areas such as stroke and MIs and GI care and many, many other areas. We do relatively well for taking care of our patients, which I'm very proud to say that I am a member of this institution that is doing so well in taking care of patients, and that our patients are generally happy. And we have a lot of patients who come back here. But it is very subjective sometimes as to whether we're doing well or not. So it's difficult to measure, but I think those two things are the biggest measure of our success.
Just sort of switching gears a little bit, I know we had touched on it earlier about leadership and how the culture of innovation emanates across the system. And there's also a bit of, you and I are both really passionate about leadership and know that innovation adoption hinges on leadership. Leadership doesn't necessarily mean you have to have a title. It just means that, you lead where you are. Can you share a little bit about some of the things that you guys are doing in terms of promoting leadership, training, and how that works?
Sure. So we have a very exciting program that we started here called the Leadership Education for the Advancement of Physicians, or the LEAP program. And this program basically is training the next generation of physician leaders. And so we train them in quality improvement, patient safety, process improvement, human factors, healthcare innovation, and general leadership skills. And we give these residents and fellows in all areas of medicine training in these areas. We have them interact with experts in these fields, people who have been in their shoes and who are now leaders in these various areas, and also guide them through improvement projects on their own. So whether it's a quality improvement, human factors, innovation projects, we guide them through those projects so that they can start practicing how to make changes and improve the way that we practice medicine. And in their future careers, we hope that they're going to be doing the same continuously, and also spread that education to wherever they end up going. So to us, as you said, leadership is not just about who's there now, but what our future looks like. And we are very committed to our future leaders here.
It's so exciting, so encouraging to hear that. Just when someone trains there, they go elsewhere, and perhaps they can take a little bit of what they learned and incorporate it and execute it, into another facility. It all boils down to execution. So I think one of my final questions is for the listeners on here. I mean, what is what is one thing, what is one action that you think someone can take when it comes to, innovating and driving innovation, whether it's in a department or across a hospital? What's one action item that you think that they can take?
Well, I think that for people who interact with healthcare in some way, the major thing to do is to identify that area of need, identify that pain point, and then talk to someone about it, bring it up to someone. So if you are the patient going into a clinic and you have some issue, bring it up with that clinic and, say that you maybe have an idea as to how it could be better, or at least just bring it to someone's attention, because the more attention that is brought to a problem, the more likely it is for a solution to be developed for that. And my personal belief is that healthcare innovation is really driven by need. Unlike many other industries where technology is pushed on us, here, it's all about clinical needs, and that technologies are brought in to fill those needs. And so if we don't know about the needs, then we can't advance what we're doing. And so if you're just there and identify a problem, identify an area of need, somewhere where we could be doing better, that is the start of healthcare innovation. And that is where you can make the most impact.
Totally. I mean, there's an aspect of healthcare innovation that just requires an inordinate amount of grit and perseverance. And I'm just happy to say that you have that, and grateful that you've been able to spend even a little bit of time with us. We know how busy you are. It's treating patients and having a lot of responsibility on your shoulders. So what is how can people follow you? How can people connect with you, or just follow the work of Cedars-Sinai? What's the best way people can kind of keep tabs on what's going on?
Thank you so much, Michael. You can follow me on Twitter. I'm at Monica JL_MD. So that's me. You can also follow Cedars-Sinai. All of our departments have Twitter handles. Our accelerator has a Twitter handle. And there's a lot of innovation occurring here that you can see just based on Twitter, and kind of follow our progress there. And we also have a lot of conferences that occur throughout the year, which you can also find out about on Twitter. And we'd love for you to join us at those conferences, whether it's VR, GI, cardiac, surgery, whatever it may be. If you want to follow what we've been doing here, we'd love to have you join us.
Awesome. Thank you again very much. So for those that are in the audience, if you found this content helpful for you, would you mind sharing it on social media with your network? We're incredibly grateful when we have new community members coming in that are just as equally as passionate about healthcare innovation, that want to really advance society at large. And anytime we can bring more people into the community that want to make a difference, we're really grateful for that. So like it, subscribe to it, share it. Every little bit helps. So again, Dr. Jain, it's a pleasure, and I'm really looking forward to our next conversation. Take care.
Thank you. Pleasure's all mine.
Bye for now.